Good day, sir. I am Kimberly Basuel from BSN 3B, and today what I'm going to perform is the nasogastric tube feeding. For the assessment, we need to check for the doctor's order, client's level of consciousness, level of knowledge and understanding, availability and functionality of the needed materials, for any clinical signs of malnutrition or dehydration, for allergies to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula. Then notify the primary care provider if any incompatibilities exist. Before commencing a tube feeding, determine the type, amount, and frequency of feeding and tolerance of previous feedings.
Prepare the following equipments: correct type and amount of feeding solution, 60 ml catheter tip syringe, a meses basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label, measuring container, 60 ml of water at room temperature, and feeding pump.
Now let's proceed to the implementation. Good day, ma'am. I'm Kimberly Basuel from NEST, and I will be your student nurse from 7 a.m. to 3 p.m. So how are you today, ma'am? Good to know. May I know your name, ma'am, and your birthday? Just for verification. So today, ma'am, I'm going to administer your food and nutrition supplement that your body needs. So this procedure will not cause any discomfort, but it will cause a feeling of fullness. But in case you feel any discomfort, you can tap my hand or raise your hand. Okay, ma'am? Thank you, ma'am. Next is perform hand hygiene and observe for appropriate infection control procedures. Provide privacy for this procedure if the client desires it, because tube feedings are embarrassing to some people. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than a pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering the feeding, check the expiration date of the feeding. Then warm the feeding to room temperature.
Rationale, an excessively cold feeding may cause abdominal cramps.
Clamp the feeding tube before all of the water is instilled.
For the rationale, clamping prevents air from entering the tube.
Ensure client's comfort and safety. Secure the tubing to the client's gown.
This minimizes pulling of the tube, thus preventing discomfort and dislodgement.
Then ask the client to remain sitting upright in Fowler's position or in a slightly elevated right lateral position for at least 30 minutes.
Just remain sitting for a while, ma'am, for at least 30 minutes. Okay, ma'am. Thank you.
For the evaluation, evaluate the client's response to the procedure. Then document the procedure and other important data on the client's chart.